Hi, everyone. My name is Marie-Lou Daudier. I'm the Senior Equity, Diversity, and Inclusion Advisor at the D2R Initiative at McGill University, and I'm very delighted to be offering to you today the EDI workshop on anti-Black racism in health research. Before we start, I would like to share a few inclusive considerations. So I use she, her pronouns, sharing the pronouns that we've referred to in email signatures, in LinkedIn titles, or when we speak at events like today are always to normalize gender diversity and the fact that our physical appearance does not necessarily determine the gender that we identify with. I would also like to share that I appear on the screen as a Black woman with straight hair and a blue jacket to share how we look like visually can offer a more inclusive experience for people who live with visual impairments. I would also like to share with you that you have received a code of conduct. There will be opportunities for you in this webinar to share some answers, to share some questions. So please do it respectfully and respecting the code of conduct that was shared with you. Je vais faire une petite note en français. Alors, l'activité d'aujourd'hui est en anglais. Cependant, étant donné qu'on est sur la plateforme Zoom, vous aurez l'opportunité de cliquer Closed Captioning ou bien sous-titrage si vous voulez suivre l'atelier avec sous-titrage en français. Bien sûr, ce n'est pas parfait. Cependant, si vous avez besoin un peu d'assistance pour comprendre l'atelier d'aujourd'hui, c'est possible de le faire grâce à la plateforme. I would also like to share a land acknowledgement. The D2R initiative at McGill University is on land which has long served as a site of meeting and exchange amongst Indigenous people, including the Haudenosaunee and Anishinaabe nations. We acknowledge and thank the diverse Indigenous peoples whose presence mark this territory on which people of the world now gather. Sharing a land acknowledgement in an event like today is so important because, as you will see in a few slides, Black people and Indigenous people share some common history of racism and also of marginalization. And I think we cannot talk about Black history in Canada without acknowledging Indigenous history as well. And I told you that I'm part of D2R. So what is D2R for those of you who might not know what we do? So D2R is an initiative that is an acronym for DNA to RNA. We aim at being an inclusive Canadian approach to genomic-based RNA therapeutics. We have a short time from 2023 to 2030 to have a very bold vision to fulfill. So our vision is to deliver genomic-based RNA therapies to benefit the health of populations that may be affected by rare diseases, neglected diseases, infectious diseases, cardiovascular diseases, cardiometabolic diseases, and chronic diseases like cancer. So to do so, we offer funding opportunities to professors and to students that can do some research on our 6 foundational research axes. So I won't read them all to you on the screen, but as you can see, we are a very diverse initiative where there could be researchers in chemistry and human genetics and social sciences. There's so many possibilities to work with us on these projects. And beyond offering funding, we shouldn't be seen as a mini funding agency, but we also offer different types of services related to training programs, services related to data science, to industry partnerships, and also to equity, diversity, and inclusion. I have the opportunity at D2R to oversee our EDI action plan, which has 3 main focus areas. And the first focus area is about supporting the progression of equity-deserving groups in genomic-based RNA therapeutics research. So we do so by doing things like supporting trainees, supporting professors. We have very dynamic communities of practices. We have 2 communities of practices, one for professors and research staff, and another one for trainees. If you want to be involved, you still can. It's always accessible, so you can write to me. We have a second focus area that's about understanding EDI challenges and opportunities in genomic-based RNA therapeutics. So to do so, we have trainings, we have awareness activities like today to understand the realities of different groups. We also have climate surveys and focus groups. And one other activity that we have are engagement sessions that will happen next week and the week after that. So if ever you want your voice to be heard in the evolution of our EDI action plan, it's possible. You can write to me. And our third focus area is about applying EDI in our research funding opportunities. So now that you know the context of the workshop that we will present to you today, there are three different parts of the agenda. So first of all, we will understand Black history. Then there will be a part on anti-Black racism challenges and opportunities, and then there will be a Q&A. In the first two parts, I'll have two or maybe more interactive questions while you'll have the opportunity to share your answers, to raise your hand and open your mic. Otherwise, there will be a Q&A at the end. So you can write in the Q&A function your questions as you think about them, or you could keep them as for the end as you prefer. And as I go through these different slides, I want you to keep in mind that some information can be hard to hear for some people. So if you need to take care of yourself during this session, if you need to take a break to walk, to come back, do not hesitate to do so. It's really important to take care of yourself during that moment. And also, I would like to share that I am not a historian. I'm simply an EDI worker that took the time to understand some of the challenges, some of the roots of our cohabitation between Black people and other people in Canada. And I thought by all the knowledge that I have accumulated throughout the years, it could be interesting to share that with you today. And also, as you may have seen, this workshop is recorded. However, when we get to the Q&A section, if you do not want us to record that portion, we can stop the recording so you can be more comfortable asking your questions. So the first part, Black history, I would like to start by a question for you. I would like to hear you if you think it's true or false, what you see on the screen. I would invite you to raise your hand to answer and not only tell me if it's true or false, but why you think it's true or false. So here's the statement. In America, the enslavement of Black people happened only in the United States of America. The Underground Railroad to freedom going from the United States to Canada demonstrates that Canadians have never enslaved Black people. Is it true or false? I see that Sophie Lorenzo raised her hand. So, Sophie, you can go.
It's false.
It's false. And why do you think that's false?
Um, because religious orders and large landowners, I know in Quebec and the Maritimes and Ontario at the very least, definitely did have enslaved people working for them.
That's very true. Thank you, Sophie. Marie-Louise? Marie-Louise, I think you can go.
Sorry. Can you hear me now?
Yes, I can.
Yeah, I was saying that this is false. Black Canadians have been enslaved for 400 years also.
Mhm.
And actually the first black slave in Quebec was from Madagascar, and I'm from Madagascar, so I learned that from my home country. But he was a boy that was taken by the missionary
Mhm.
under the guise that he was going to be educated, but he was a slave, so he was one of the first slaves that was here.
Thank you for sharing that, Marie-Louise. I won't address that, what you just said in the training, but the name that the name of the slave that Marie-Louise is talking about is Olivier Lejeune, and it's only through the work of the historian Webster that we were able to find this information only very recently. So thank you for sharing both your answers. I will complete what you're saying that by adding that some people don't necessarily know that it's false, and there's some confusion that could be explained by how history was transmitted to us in our history classes in high school and in elementary school. On my side, I grew up in Canada, and the information that was shared with me and other people my age was that the Underground Railroad was a network of abolitionists to help freedom seekers have access to Canada, a land where slavery was illegal. So that's helped 30 to 40,000 fugitives. So having that information in mind, that information is not false, but it's not complete. There are some omissions. The fact that we had slavery abolished in Canada 30 years before the United States doesn't hide the fact that doesn't make it true that we didn't have slavery in Canada. It's just, it was some part that was omitted in our history classes. Now I see more and more history teachers that are taking the time to add more information to the curricula that we see in classes growing up here. But that creates this sort of like dissonance of people not knowing why. They're just saying, oh, it was less bad in Canada. But there are atrocious things that happen in Canada as well. And I think it's very important to be able to acknowledge them and take moments like today to speak about them. So it all started to the transatlantic slave trade. And what happened was that maybe before I go through the different dates, I would maybe make you focus on the image that I chose for this slide. So on this slide, you can see that there are Black people that are put for sale. There is the word in N that I crossed, and it says for sale at auction with the given time. So it's just to show you how our bodies were dehumanized, how people that looked like me and darker were treated. I think it's a powerful image to see how disturbing that time was. And from the 17th to 19th centuries, between 12 to 15 million African men, women, and children were sold into slavery in the West Indies, North America, and South America. Over 2 million Africans lost their lives before arrival due to maltreatment and malnutrition. And there's a very important book about this by the historian Marcel Trudel. The title of the book is Canada's Forgotten Slaves, 200 Years of Bondage, where he estimated that there were approximately 4,200 enslaved people in the area of Canada, now known as Nouvelle-France, and later in Upper and Lower Canada between 1671 and 1831. And you remember earlier I told you how it was important to, when you talk about Black history, to talk about Indigenous history at the same time. Well, that's why it's important. We shared that slavery history in Canada. 2/3 of the slaves were Indigenous and 1/3 were Black.
Mm.
And also, the Slavery Abolition Act of 1833 ended slavery in the British Empire on August 1st, 1834, which laid a path to freeing 800,000 enslaved Africans and their descendants in parts of the Caribbean, Africa, South America, as well as Canada. And it is only in 2021 that ex-Prime Minister Justin Trudeau recognized officially August 1st as Emancipation Day. And unfortunately, this did not get much media attention. In some other provinces, some organizations actually have the day off for Emancipation Day, or they dedicate the whole day to getting information on Emancipation Day. In Quebec, I have seen very few organizations doing different type of things for Emancipation Day. This is why since 2021, it's really important for me wherever I am to share the knowledge about Emancipation Day. And because there were big gaps in how history was taught to us in high school and elementary school, it's really an opportunity to rectify that gap by sharing information during that day. And it's really important because there's really atrocious things that happen linked to slavery. We can think about how people were dehumanized through physical violence. Sometimes it was through hitting, through whipping, through burning people. It could be psychological, such as insults, slurs, not like racist jokes. And since that time, we still have some of that legacy in how people interact with each other. There was also sexual violence. So, there were some slaves that were raped by their owners, and people were easily killed. So you saw the image earlier where people were put for sale just like objects, and it was easy to discard Black people just like objects also. So if some Black people disagreed with certain things, they could easily get killed and get no justice for that. Dialogue was impossible, and sometimes the only option for some people was to flee or protest or even result in sacrifice. So there were suicides at that moment. Sometimes there were some women who were pregnant who were just saying, I don't want to give that life to my child, so I'm just going to end it here. Um, and also, when some people say, oh, it wasn't as bad in Canada, one concrete example of a symbol of resistance, an important name, something that happened in Montreal, in the city where I'm talking to you right now, was the story of Marie-Joseph Angélique. She was the slave of Thérèse de Coulanges. And Marie-Joseph Angélique was tortured, hanged, and burned in public because she was charged by fire by causing a fire in Montreal. And at the time, if you do some readings, you can see that a lot of people thought that she didn't do it, but to get justice at this time was almost impossible for a Black person. So what happened is that she endured those harsh treatments, but on top of that, they asked a Black slave to do all these things to her. And the name of that slave was Mathieu Léveillé, and that happened in 1734.
Sorry, I thought you were coming in about half an hour.
And also, despite all these harsh treatments, the slaves really played an important role in the Canadian prosperity. They played important roles such as field workers, domestic workers, and even not being recognized so, but some Black people were learning quickly like what their owners was studying on the side. Sometimes they were helping their owners to help their children for homework. So sometimes they were unofficial scientists, nurses, or professors without being recognized as well. And after the abolition of slavery, gradually Black people had access to education. So there was there were barriers as early as elementary school, and we can look at the early 19th century. Ontario and Nova Scotia established legally segregated common schools. In the 1840s, school segregation was formalized across Canada, especially in areas with many newly arrived freedom seekers. And these policies barred Black children from attending certain schools. I'm going to clarify what I mean by certain schools. So there were some schools that were only for white people. There were some schools that were only for Black people. There were some other schools where you had classes that were only for white people and classes for people of color. You had also within the same class, sometimes you had white people in front and Black students or people of color at the back on benches at the back of the class. So there were different scenarios at the time. It's only in response to Black parents' activism that racially segregated schools were gradually dismantled. But I should have written were gradually, very slowly dismantled. As I told you, I'm not a historian, so I cannot validate the date 100%. But when I was working at the Government of Canada, one of the projects that I was working on was to develop an action plan for Black researchers. And as we were building the argument, one of my directors, he had a background in history. So we were able to find that the last school, and maybe there's another date, but the most recent segregated school that got dismantled was in 1983. So that's very close to us, that date. And it was in Guysborough County in Nova Scotia. There was also an equitable access to education for Black people in Canada in post-secondary education, and that is particularly true for medical and nursing programs. So in 1916, the Montreal Maternity Hospital affiliated with McGill University barred Black male students from admissions. In 1920s to 1930s, and again from 1945 to the early 1960s, McGill enforced racial restriction on Black students' admissions. From 1930 to 1947, Black medical students in Montreal were denied hospital internships, and as a result, some McGill students that were medical students had to complete their residencies by going to the United States. So McGill arranged for internships at Howard University in Washington, D.C., where that was possible. And also in nursing schools, there was the frequent case of Black women getting denied, especially from the early 1900s to the 1940s. Discrimination was often justified by the claim that some patients did not want to be treated by Black nurses, and some Black nurses that got the title had to limit their practice to taking care of other Black patients. And as we are looking at important elements of Black History Month, I think if we speak about health research, we have to share the name of Dr. Addison Ruffin Abbott. So after earning his license to practice medicine in 1861, Abbott went to the United States and served in the Civil War and was recognized for his duty as one of the 8 Black surgeons in the Army. And then after his work in the Army, Abbott came back to Canada and he practiced as a physician and as a coroner, and he died in 1913. And I'm actually surprised because I see a lot of people attend Black History Month event, but I often see people that don't know why we celebrate Black History Month in Canada. So I thought about ending this section of the workshop by explaining why we celebrate Black history in Canada. So it all started with the influence of the United States. So on the screen, you see 2 important faces. You see at the left, Abraham Lincoln, and at the right, Frederick Douglass. So what had happened was that the Association for the Study of African American Life and History, an organization that was really focused on research on African American history, what they did, they asked to have a week dedicated for Black people. And they chose a week in February that coincides with the date of the birthdays of Abraham Lincoln on February 12th and of Frederick Douglass on February 14th. And after choosing that week, what happened was that the Black United students from the Kent State University were actually very motivated with that week, and they wanted to extend that week to a whole month. And then in 1976, the idea was captured by the government to really have this month celebrated in the United States. So I will share with you part of the speech of Gerald Ford when the Black History Month became official in the United States in 1976. I'm going to read a part to you. So he calls on Americans to seize the opportunity to honor the too often overlooked achievements of Black Americans in every area of endeavor throughout our history. And afterwards, there's different countries that joined the movement, including in Canada. And in Canada, you must remember this face because it's because of Jean Augustine, who was the first Black woman elected as a member of the Canadian Parliament, that we have Black history in Canada. And this happened in 1995. And as her request got accepted, she shared a speech. I won't read all the speech to you, but I think it's important to capture maybe this part of her speech where she was saying, I was a teacher and I noticed that school curricula mentioned very little about Canadians of African descent. The same problem existed for Indigenous people. If there was a reference, it was in a footnote or in the margins. Black Canadians were not even part of the narrative, nor were they portrayed as people who had contributed to the Canadian society. So I know there's a lot of events where we celebrate Black people, where there's like arts, where there's eating food, and all of that's very important. But I think to capture these words, to take the time like we're doing today, to actually share the knowledge on Black history is very important. It's important work to do. So I shared these important words with you. Now I'm going to go to the second portion of the workshop on anti-Black racism challenges and opportunities to see how we can navigate current challenges together. So I'm going to share a few basic definitions with you so you can have an idea of what lens we're putting to address different issues. So racism is an important definition to understand here. So it's an ideology based on the belief that there is a hierarchy between human groups or races. It can be openly displayed in racial jokes and slurs or hate crimes, but more often in our organizations, it can be more deeply rooted in attitudes, values, and stereotypical beliefs. And in contrast, anti-Black racism refers to the behaviors, the beliefs, the stereotypes, the discrimination, and inequities towards people of African descent. It is rooted in slavery and its legacy. So I have a question for you. Why does it matter to talk about anti-Black racism in health research, and why isn't it enough to just focus on racism in health research? So I'll take maybe one or two interventions here. Don't be shy, it's not a test. Marie-Louise?
I'll go. I'm not sure that this is going to be the right response, but anyway, so I do health research, and when I was a doctoral student, what we've read in our seminar was that there is some research showing that there are that there is inequity in terms of access to health resources because first of all there is a stigma, there is the matter of racialized and especially Black people, African Americans. I did my PhD in the States, so it was about African American who wanted to be seen by doctors who resemble them because those doctors share the same experiences, and so when they treat the patients, they are able to consider the cultural experiences of the African American patients. But what some of the patients said is that when they see someone who doesn't look like them, who doesn't share the same experiences, sometimes they have stereotypes about black and African American patients, saying that the pain is different. So there are a lot of a priori and stereotypes that are associated with being Black, and so those things sometimes make people less susceptible to ask for help when they need to ask for help, and this is especially important in mental health, for example, because mental health is a big issue. But then if you don't really believe that the person that's gonna see you really understands your whole experience, then you are not going to seek for help. And so I think that it's important to consider all of the things that makes Black people not being able to be treated and be seen in traditional health settings, healthcare settings.
Mm-hmm. That's a very good answer, and I think I'm going to address a bit of parts of this answer throughout the different slides that we'll see together. And the inequities to access, that's something that's we see all the time, and we're going to navigate how we can have an anti-Black racism lens to actually help make make it a reality that Black Lives Matters, right? So to complete your answer, Marie-Louise, there's 4 topics that we will explore in the next slides together. The first one is about the challenges of Black researchers in research labs. So there's ongoing challenges that we must address because representation is one thing, but being treated fairly is another. The second is the lack of research to understand the challenges faced by Black communities. The third is the lack of empowerment of Black communities in health research. And as you mentioned, Marie-Louise, limited access to quality healthcare. So if we look at the first point, the challenges of Black researchers in research labs, of course, representation is an issue. It's something that we can see in some labs. But even though there is representation in some research labs, there could still be some unfair treatment. And that's why to apply an anti-Black racism lens could be interesting. Some of the issues that we could think about in terms of equity and inclusion that are rooted in our legacy of Black history in Canada are unconscious biases and microaggressions. So unconscious biases happen through a process, through a neurological process where our brain will discriminate some information to make decisions more easily. So for instance, when I grabbed this glass of water, I had to discriminate everything around that was not a glass of water to take it quickly. When I take water, I'm not discriminating anyone, but my brain can do the same thing when choosing who to collaborate with, who in the research lab will have access to opportunities like mentorship, like scholarships, like networking opportunities, conferences, publications. So to really help to address anti-Black racism, it could be to really take the time to see when we exclude Black people from some opportunities because they can be in the lab, but if they're never invited to have some different opportunities, that could be another issue. Microaggressions as well. So the microaggressions will be the expression of our biases. So it could be through jokes, through insults, through inappropriate questions, through the ways that people act with each other. Or sometimes I should even say macroaggressions. Sometimes the joke is so violent that we just know it's a racist joke, right? And I think it's important to address that because there was a study in 2020 from the Indeed website, so the job search website, that did a study on the impact of microaggressions in the workplace. And the impacts can be mental health issues, can be a lack, like diminished self-confidence, and could also be even going to suicidal thoughts. So sometimes when we say, oh, it's just that one joke that we did in the lab, sometimes when there's an accumulation of bad jokes, bad comments, it could really have an impact on the researchers. So we should think about that. So what can be done to reduce bias and microaggressions towards Black people in that context? We could understand our biases. So for instance, I invite you to take the Harvard University Implicit Association test. So this test, I take it once in a while. Even if I'm working in EDI and I'm a Black woman, I do have unconscious biases. And it's nice to take that test to see where you're at. And the idea here is not to say whether we have unconscious biases or not. Everyone has biases, but it's more about mitigating those unconscious biases. It could be through getting some training on unconscious bias. It could be by validating that you're not excluding Black people for reasons that are not related to the criteria for why you're recruiting them or sharing opportunities with people. It could also be by creating rigorous processes to mitigate unconscious biases. If you're curious about this, you could write to me at any time. I could give you more information about that. You could also work on limiting microaggressions by sensitization, by opening dialogue, taking care of your own emotions to fuel yourself in front of injustice. And if necessary, you can use the service at McGill University. We have an office of mediation and reporting. So if you need help with a situation, it's possible to get the assistance. You can also create rules and plan for equity and inclusion in research practice. So for instance, at D2R, when professors get our funding, get access to our funding opportunities, they get access to support from me as well, and we go through an EDI plan for their research projects. And there's a part on EDI in research design and another part of EDI in research practice. And we look at how inclusion, for instance, when we speak about inclusion, it's very different from the term diversity. When we speak about inclusion, we're simply speaking about everyone feeling welcome and valued and having concrete efforts and intentional actions to make that happen. So we can discuss about different ways to really make sure that everyone feels welcome, to make sure that microaggressions are not necessarily something that is admitted in the research lab. So we have conversations around these things. What happened at D2R? What happens at D2R is that after getting funding, they get access to 1 hour meeting with me, all the PIs. So it's different strategies that we discuss together, for instance. Another challenge is the lack of research to understand challenges faced by Black communities. So on the screen, I have put the image of Black Studies Matter. Is there someone in the crowd that knows what is Black Studies? What is that term? It's okay. I see someone raise their hands. Sorry if I'm not saying your name right. Azukago, did I say your name right?
Yes, can you hear me?
Yes, I can hear you very well.
Okay, great. So yes, it's fine. It's you pronounced it right. It says Ukego. So I'm not really sure, but if I had to guess, I'd say that it's something along the lines of like clinical, when there's like research on clinical trials, sometimes there's not enough emphasis on putting Black participants in their clinical trials, or even doing research on subjects that touch Black people more than others. So for example, um, there's I forgot the name, but there's a red blood cell condition that touches Black people more than other ethnic groups, and so often there's not enough funding and research that addresses that health issue. So I would think that's it.
Thank you for that answer, Izukego. I think it's a very good answer, and it's part of the answer. Actually, Black Studies is a term that is unfortunately not known enough, but it is an umbrella term to capture different issues of Black communities, including things like clinical trials, like you mentioned. So different examples we could think of easily are how Black issues can be addressed in history, literature and arts, politics and activism, but it's much more than that. And as you mentioned, Azukego, it could directly be in health research. So in health research, we could think about how we can capture, how we can analyze anti-Black racism impacts through Black health outcomes, including mental health access. So Marie-Louise, when you were speaking about that earlier, so that could be part of Black studies, for instance, investigating the barriers like cost and stigma. It could be disease disparities, such as identifying higher rates of conditions like diabetes and hypertension in Black communities. It could be medical mistrust, so to understand the ripple effect of experience of unethical testing and related challenges and representation in biobanks, in genetic trials, and in health technology testing. Or it could even be racism as a health determinant. So exposure to racism can lead to psychological and physiological negative impacts. We could think about the stress, and sometimes the stress of being a victim of racism can be linked to starting to be more vulnerable to get some diseases as well. And what can be done? Oh, maybe one thing that wasn't on this slide, but you talked about Azukego in your answer. You mentioned that it's often not funded enough. So when I was working at the government of Canada, I was leading a project that was called the Action Plan for Black Researchers. You can Google it. We really advocated for the government to have possibilities of funding for researchers that focus on Black studies. Because before that, some researchers that were specializing in Black studies in areas such as we discussed on the slide were not getting access to funding. It was not identified as an official category in on the TIPS website. So because of this work, since 2024, it is possible. So we're advancing very slowly but surely on that question. So if we continue, what can be done by any researcher? Because I know, like, I want to share with you the information on Black studies, but I know that you are not all specialists in Black studies. So maybe a takeaway is that you can apply the Black studies lens to any type of research that you do when it's feasible. So in terms of research design, for instance, when you build your research question as early as that, sometimes we have our research question in mind, or intellectual curiosity, or just alignment with the funding opportunity, and we're not thinking about the impact on the broader community. So for instance, to consult with different community members, including Black people, but also other equity deserving groups, could help to shape a research question that could be even more impactful for the broader society. And we can also review the literature on Black people related to the research topic that we're working on, for instance, and address the gaps. We can also collect data and analyze data from Black communities and also disseminate results with Black people. So you could look at Black scientists networks to share that information with, or when doing studies in, for instance, endemic countries, it could be interesting to share the research results with these countries as well. A third issue is the lack of empowerment of Black communities in health research. So we can think about here how research can be an important outlet to empower communities. So it is more and more documented that researchers have been using data of Indigenous people to do studies that advance their careers without benefiting or having a positive impact on Indigenous communities. For instance, many Indigenous people had their data collected without being informed of the result of these studies. Therefore, Indigenous are now rightly so asking for data sovereignty to have research on their communities that can also benefit them, right? And not only advance the career of some researchers. Not the same case, but similarly so. For people who were there with us last year when we had our webinar for Black History Month, we had the Professor Momar Ndao that was sharing some issues that he saw in some countries. So for him, for example, he was saying in some endemic countries, some people received, well, they accepted to do the research because they needed the money, but they didn't understand the consent form because either they couldn't read or they couldn't even understand the language of the form. And after that, they never heard from the study again. So there's issues of sharing the data also with the communities that are studied for Black communities as well. So what can be done to empower Black communities in health research projects that affect them? First of all, it could be including Black leaders in the outreach strategy to collect diverse data from their community. It could be also explore diverse ways to communicate the purpose of the study. So for instance, with the examples that Professor Momar Ndao shared with us last year, we could think about an audio consent form. So it could be more empowering for the person to know what they're doing. It could be in the language of the participant of the study as well. And also to plan a dissemination strategy to see how you can share the study results with the communities that could benefit from having that knowledge. As a very concrete example, for instance, at D2R, Professor Jörg Fritz is working on the identification of antigen targets for Mpox vaccine development. And in doing a very comprehensive literature review, he actually was able to find that there was a prevalence of Mpox in the Democratic Republic of Congo. And through having this information, he did work to outreach with some contacts that he had for like professors, but also community organizations to have access to Black leaders to get people involved in the studies. So through that very well-planned process. He was access to get information, get data from people that are very vulnerable to Mpox. So for instance, they were able to get information of people that were in local bars, even sex workers. So that really creates a study that is more impactful by empowering Black leaders to be able to have the dialogue, to build trust, to be able to participate in studies like that. And with Professor Jörg Fritz, we have discussed after his study, even though it's not like now, but to think about ways to disseminate those results so people that participated in the study can be empowered by the information and the development of the research. And a last point that I'd like to share with you is the limited access to quality healthcare, like you mentioned, Marie-Louise. So the disparities in receiving quality healthcare are apparent for Black communities through various issues, such as, for instance, last year we had a Professor Loidi Jerome-Yeska, who was one of our panelists for our Black History Month event, and she is a specialist in pediatrics. And she was sharing with us how there were higher rates of mortality in Black mothers and newborns experienced. There's also premature death. If we do some research, we can find compared with white people, Black people can die prematurely from all types of diseases such as COVID-19, strokes, hypertension, and diabetes. And that can be due to different things such as financial barriers or experience of mistreatment in the health system, of stigma, a lack of awareness. And all these things can lead Black people to wait too long before getting care or before having access to healthcare. So what can be done to address these disparities? So we can develop research that document factors contributing to the limited access and use this research to create policies leading directly or indirectly to dismantling anti-Black racism. We can also get involved in different government levels. If you have the time and energy, it's possible to volunteer for these type of things. Outside of work myself, I take some time, a few hours a month, to actually help my city to see more clearly in things like that. You can have conversations about addressing anti-Black racism at different stages of your academic and professional journey. It's important to have dialogues about these things. And the last slide that I will share for this section is about playing an active role beyond this workshop. If you feel inspired after this workshop and you want to play an active role, you can continue to get informed and celebrate important moments of Black communities. We're only at the beginning of Black History Month right now, so if you want to join activities, there's activities on the campus at McGill during the whole month. If you just Google Black History Month McGill, you'll find all the activities there. There's also activities in different organizations in different cities, so you can take part in these activities. There's also Emancipation Day. So I told you about how important it is to me to share the knowledge about that day. So on August 1st, you can look at what the government posts about Emancipation Day. You can share that knowledge also with people around you to make sure that people know about this history that we have in Canada. You can also do different things in terms of research practice. So this is more of a summary of different ways that were discussed throughout this workshop through sharing opportunities. Sometimes you could think that you might not have a big power, but just by saying to a Black person beside you, did you know about this opportunity? Did you know about this event? Did you know about this networking opportunity? That could be a game changer for that person's career. So to think about these little things and being an ally that way could really help contribute to reduce bias and microaggressions. We spoke about that earlier, and take time to develop trust and empowerment of Black communities through work when that's feasible. And there's different EDI community engagement possibilities through D2R. For instance, we have an EDI newsletter. It doesn't come out often, but maybe once every 2 months, every 3 months, I share some information, not only on Black communities, but in EDI in general. Also, as a Kego, you spoke about the importance of Black people in clinical trials, and we are thinking about that right now. We're working with the Pan-Canadian Genome Library, with the IR-MUHC, and with community organizations to develop in May roundtables where we will have patient partners, community members, professors, and students to really talk about this mistrust and what can be done and co-create solutions together. So if you want to be part of building these roundtables, of these conversations in these roundtables, do not hesitate to send an email to me. And you could be part of the communities of practices we have at D2R. And also next week and the week after, there will be engagement sessions at D2R. So if you're a D2R related professor or a student, you can share your input on the evolution of our EDI action plan through our engagement sessions. So now I'll open up the floor for a few questions.
Sorry, can I speak? Sorry.
Yeah, of course.
So you mentioned there was like community events, or actually you mentioned that um like you take some time off to do like community events and helping. So could you give a few examples of like what you do or what you think we could do?
Well, I really advocate for taking our place on boards. There's community organizations sometimes that could be needing help. I could think about community organizations that we have collaborated with at Detour, like Audace au Féminin, that actually empower Black women, and they're collaborating with us for the roundtables that we're creating for diversity in clinical trials. There's community organizations like Fondation du Cancer du Sein du Québec, so the Quebec Foundation for Breast Cancer, if I'm translating well. So these community organizations work directly on issues related to health. So sometimes it's possible to just ask them if they need help, maybe to sit on a committee, to sit on their board, to bring your expertise, because sometimes it could be useful to have the knowledge of some researchers to help advance these community organizations. Sometimes it could be more in terms of advocacy. For instance, I volunteer at the city of Longueuil. I'm on the Intercultural Council of the city. There's an Intercultural Council of the city of Montreal also, where you could share ideas directly to the city on how they could advance different things for people from different cultures. So there are different ways like that that you could just send an email, see if it's possible, and often different organizations may need help. So I don't know if that answers to your question.
Yes, it does. Thank you very much. I was just looking for like examples, but you said like community groups, so just maybe look for groups around my area. So, right. Thank you.
Yeah, thanks to you for that question. Are there other questions? Well, I won't keep you longer if there's no additional question. I will end maybe by sharing a quote that I really like from Nelson Mandela that says that education is the most powerful weapon which you can use to change the world. And I think that is very true. And I think events like the ones that we have today is an important way to understand the legacy, the history, the history of Black people in Canada. And I would ask you also to scan the QR code because we always want to give better and more better experiences to people attending our EDI events. So if you could just scan the QR code and fill up the form. And thank you so much for taking the time in your day to learn more about Black history. Thank you.